waterways are put at danger by this industry daily, from spills and releases, frack outs, casing failures, truck accidents, and numerous other incidents of operator negligence leading to hundreds of violations. The waters of the Commonwealth and private drinking water sources have been polluted. Communities have tried to negotiate in good faith with industry before. We have asked again and again at conferences with DEP and operators and in local hearings. And look where we are now. How many more times can we ask for the protections of our basic rights to health and safety? We can't wait for legislators who are lobbied every day to work in the industry. Governor Shapiro, we as Pennsylvanians are in desperate need, and we have only you to count on to protect us. Thank you.
Thank you, Jillian. Next up, we have Matt Kelso, Manager of Data and Technology with Frac Tracker Alliance.
Thank you, Shannon. I want to talk to you today about two very different people, Attorney General Josh Shapiro and Governor Josh Shapiro. The Attorney General Shapiro filed criminal charges against one company, EQT, for fudging emissions data. Governor Shapiro holds that same company up and says that they're leading the industry in showing how we can reduce pollution, I guess by changing the numbers. Attorney General Shapiro said that all companies should have a 2,500-foot setback between homes and drilling sites. Governor Shapiro says that one company's voluntary 600-foot setback is a big deal. Attorney General Shapiro said that the DEP failed to protect Pennsylvanians during the fracking boom. Governor Shapiro said, with barely any changes, that we are adding to an already robust regulatory framework. I think that Attorney General Shapiro would have been appalled by the low bar set by Governor Shapiro's administration.
Thank you, Matt. Next up, we have Laura Dagley, a nurse and medical and environmental health writer with Physicians for Social Responsibility, Pennsylvania. So in August of this year, the University of Pittsburgh researchers and the Pennsylvania Department of Health released results of 3 studies showing links between fracking and severe asthma, lymphoma in young children, and poor birth outcomes in newborns. The results of the studies are not news because they confirm dozens of other epidemiological studies and hundreds more peer-reviewed scientific studies, many that were conducted in Pennsylvania, showing undeniably that something about fracking damages the health of people living near frack gas wells or other infrastructure. Unsurprisingly, the research also showed that the closer one lives to fracking sites, the higher the risk for suffering for health impacts. That complicates pregnancies and leads to poor birth outcomes. It increases the risk of asthma and other respiratory problems, heart disease, depression, anxiety, and cancer. The dangers have been known and available to our Department of Health, our governor, and other policymakers for years. But Governor Shapiro continues to let Pennsylvania residents become numbers in a research study. We know beyond a doubt that the chemicals used in fracking and the radioactivity found in its wastewater are bad for human health. We know that the research has shown health harms, and we also know the stories of people living near it. They can smell it, they can taste it, they are getting sick from it. We know the closer we are to it, the higher the risk, and we know there are no safe levels of exposure to these chemicals, especially in pregnant women, children, the elderly, and those with pre-existing health conditions. At Physicians for Social Responsibility, as a group of physicians, nurses, and other healthcare providers, we are tired of seeing the injustice fracking has brought to our communities. Our patients are trying to make the best decisions for their health, yet they are getting sick from something they cannot control. Who can control it? Governor Shapiro, but instead he is allowing fracking to continue to proliferate in the Commonwealth, while evidence to its harm to Pennsylvania's health, the environment, and the planet's climate system builds up. With all the research available to him, it is appalling that the Governor Shapiro believes fracking can be done safely in Pennsylvania. We don't need more studies, we have enough information. What we need now is action, with health and protective policies from Governor Shapiro, ensuring Pennsylvania's constitutional rights
should not be celebrated as such. The statement reveals underwhelming protections and multiple loopholes, excusing CNX from public disclosure of relevant information. Furthermore, with respect to setback distances, CNX does not promise much more than what is already legally required of it in Pennsylvania, and there are no stated consequences for failing to deliver on those promises. More specifically, the statement describes a voluntary increase from the legally required 500 feet between gas wells and occupied buildings to 600 feet, with a 2,500-foot setback from schools and hospitals. While that is a marginal increase over current requirements, it is a major step backward from the grand jury recommendations released under Attorney General Shapiro in 2020, which recommended a 2,500-foot setback from all buildings. At the Environmental Health Project, we recommend an absolute minimum 3,300-foot or 1 kilometer setback from small wells and other facilities, and a 6,600-foot or 2 kilometer setback from large well pads and other facilities. These distances should be considered safer but unsafe. They are based on a large and growing body of academic research and a recognition that farther is ultimately better for reducing health harms, but we have no evidence that shale gas development can be done without harm to human health, and there is no established safe distance from well pads. Dozens of peer-reviewed epidemiologic studies and hundreds of other investigations conducted over the last decade point to a range of health harms from exposure to shale gas emissions, particularly from well pads. The Pennsylvania Health and Environment Studies, 3 new taxpayer-funded studies released earlier this year, revealed higher risks of asthma, cancer, and adverse birth outcomes for people living near well pads. Some of those impacts were noted at distances as far as 10 miles away, with higher risks noted at closer distances. Governor Shapiro has yet to release a statement about the findings of these studies, and is instead diverting attention to this new collaboration, one that will likely delay necessary actions for several more years. Pennsylvania is not in a position to allow more people to be harmed in the name of waiting for one more study. Thanks to years of studies already done, we have sufficient information, but we have yet to see any type of swift or comprehensive action on the part of the Commonwealth to protect Pennsylvanians from the harms of shale gas infrastructure. We call on Governor Shapiro to acknowledge the health risks associated with shale gas development today and to take steps to reduce them. Greater setback distances would be a good place to start.
Thank you, Allison. Our last speaker today is Jay Walker with Clean Air Council.
Hi, my name is JT Walker. I'm a Southwestern Pennsylvania Advocacy Coordinator with Clean Air Council. Clean Air Council stands here today with a coalition of partners to call on Governor Shapiro to take a stand for clean air and clean water. He can do this by holding off on a disastrous partnership with repeat offender CNX. Instead, Governor Shapiro should enact a protective buffer between dangerous fracking infrastructure using the authority he already wields as governor of our Commonwealth. Through his new agreement, Governor Shapiro relies on industry to monitor itself to protect the health of Pennsylvanians. A blatant conflict of interest. Instead of delivering radical transparency, this agreement will put the foxes in charge of the henhouse. There's nothing radical about it. Instead, Governor Shapiro must use his authority as governor to implement more of the grand jury report recommendations that he himself produced as the former Attorney General. Through the authority granted to him by the Air Pollution Control Act and the Clean Streams Law, he should order the DEP to enact a protective buffer of 2,500 feet between fracking infrastructure and sensitive sites, such as homes and schools. No further legislative action will be required, and doing so would protect the health of countless residents from the direct harms of the fracking industry. Thank you.
Thank you, Jay. That concludes today's event. We'll stick around for a few minutes if members of the media have questions, so we can open it up. And
thank you, member of the media.
More for those watching, please visit the websites of the groups represented here today.